Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Hello, doctors, and welcome to today's program. What I want to talk about today is competency leads to patient prediction. Competency, let's define it first. Competency is the ability to meet all of the requirements and one who has the physical and mental capabilities to meet the demands of a situation or work. So it's the ability to meet all the requirements that are needed to handle something perfectly. That's competency. Where does it come from? It comes from Latin. It's to strive for the attainment of something. So when somebody is highly competent at what they do, it means that they're really good at what they do. They can meet the demands of the situation. Now, let's bring that into patient care and personal injury. In personal injury, in the personal injury market today, one of the biggest competencies that has to improve is the competency of the doctor understanding exactly how badly injured his patient is. Competency comes from knowledge. It comes from knowing. It doesn't come from being blind to something. It comes from knowing it and understanding it. Spinal ligament injuries are the number one cause of pain and disability in the world today because, in general, the market is highly incompetent in understanding how to first diagnose this condition. We cannot get a good result with patients unless we understand how to diagnose the condition. And the idea out there today that MRI is the best way to diagnose a ligament injury is absolutely ludicrous. I mean, ligament injuries have two imaging biomarkers. There's 220 specialized ligaments. 23 of those are discs. Yes, you're going to pick up a disc herniation on MRI, but that's 10% of the disc structure for the most part. The other imaging biomarker that's so important is excessive motion, because when ligaments are damaged in the spine, it causes excessive motion. That's what we can see on imaging, and we can determine how badly damaged these ligaments are by how much excessive motion there is. And of course, we have the combination. We could have both excessive motion and disc herniation at the same segment if a disc is involved, if it's in a segment where there's a disc involved. Remember, in the craniocervical junction, we have no discs. So the only thing we're going to see there is excessive motion. Now, how does competency of this lead to patient prediction? It's really simple. The more that you understand your patient's injuries, the more that you understand the path that the patient is going to take. And let me give you an example. With spinal ligament injuries, patients will start to receive conservative care. Now, the doctor that understands what that patient's going to go through is able to predict what they're going to go through because they understand it. In other words, if I've been down this path a lot of times before, I am able to take and predict. If I'm a Sherpa and I look at somebody and I say, wow, they're out of shape, I'm going to predict that they're going to get altitude sickness. So I'm going to take precautions. I'm going to have more oxygen for them. I'm going to have more needs to fit what I predict they're going to need. That's what a good guide does. And doctors in rehabilitative care today are guides. You're guiding the patient through their recovery. That's what you're doing. And you have to know, the more confident you are, the more that you know what they're going to hit along the way. And every patient is different. I mean, a patient that is 45 years old, out of shape, obese, has high blood pressure, is on 2 or 3 different medications for health conditions, is not going to rehab the same as a 25-year-old who has, 6% body fat, is in the gym 4 times a week, and is a vegan and completely hydrates their body. These people are they're going to rehab differently. But when you have spinal ligament injuries and you know spinal ligament injuries, then you can predict. One of the biggest predictors, when you get back test results that show how badly damaged a person is, and you're explaining it to the actual patient at that point. It's very easy to say, look, most people will find that they will start to gain improvement in recovery quite nicely. However, ligament injuries cause an instability. Anything that's unstable is prone to erratic or unpredictable behavior. So what can happen is you can feel like in care, and this is actually what happens, doctors. You can feel like in care that you're doing great. You're moving along just great. And all of a sudden you have a setback. You slept on the couch wrong. You slept in a funny position wrong. You slept with somebody's pillow that was different than your own pillow. You fell asleep at work in the chair, and you had, your neck was in a funny position, and it feels like you're right back at day one with care. You're not. You need a treatment or two, especially if I'm speaking to the chiropractors out in the treatment community. They need an adjustment or two, and usually they're right back to normal. Now, if you don't tell them, hey, 1 month, 2 months, 3 months into care, you can experience this, and they experience it, then they think that your care did not work. They think that your care is not good. They think that it's failing simply because you weren't competent in the route. You weren't competent in guiding the patient because you haven't worked with ligament injuries enough to know that, of course, that can happen, and you can explain that to the patient. And when you explain that to the patient, if a patient now hits that, if they now hit, oh my gosh, I woke up, I was watching the Green Bay Packers get beat by the San Francisco 49ers, and I fell asleep, and oh my God, it feels like my neck right like it was after the car accident 3 months ago, and I've been in treatment for 3 months. Oh my God, this isn't working. And that's what they think. That's what they will think, right? So if that's the case, again, what you want to do is you want to actually communicate that. Now, here's another example. When a patient has a serious ligament injury to the spine, because it causes an instability, they may need lifetime care. As a doctor of chiropractic, been a licensed doctor of chiropractic for 30 or 31 years. I have been adjusted ever since I was born. My uncle was a chiropractor, so I've been adjusted my whole life. I have very little spinal issues. Matter of fact, I've never had a problem with my back. I've never had a problem with my neck. Have I been in car accidents? Yes, I have. Have I been in rugby accidents, rugby injury? Have I had rugby injuries? Yes, I have. Have I had sports-related injuries? Yes, I have. Broke my arm in 2 places. I broke my leg once. I broke my collarbone twice. I broke my scapula, my shoulder in 5 places. So yes, I have had injuries. But do I suffer from any kind of ongoing chronic pain in my spine as a result of any of these injuries? No, I do not. Why? Because I routinely take care of my spine. I routinely practice maintenance of my own spine. Now, a lot of patients don't understand that concept. When you have a ligament injury, it can cause the patient to need more care. So let me give you a predict where this comes in. So week 1 with my patients, I'm telling them about the severity and location of a ligament injury, and I'm also explaining that this can mean that they need some ongoing care, 2 visits, 3 visits, 4 visits a year, just to help maintain their spine, much like you would go to the dentist twice a year just to help maintain your teeth. You may need that. Now, I'm talking about supportive care now in week 1. I'm not talking about it when it comes up 3 months, 4 months, 5 months later. I'm talking about it right away because it's a fact of life. Now, let's say at the end of care, the patient is perfect. They feel great. They don't have any problems. They don't have any pain. And now they're having a hard time understanding why should they come back and see me 4 times a year for the next year or 2, just to make sure that this all stays stable. They don't understand that, so they don't opt for it. So now I'm explaining because I have the ability to predict. I'm competent in this field. I'm saying Mark, I'm saying Jeff, I'm saying whatever the patient's name is. I'll just use for an example, his name is Mark. Mark, do you remember what I told you about these ligament injuries? I said that they cause an instability, and anything that's unstable is prone to erratic or unpredictable behavior. Well, the reason why I'm saying that is because you can start to have a symptom come back because of that instability. It does not mean that our care failed. So I notice you're not opting to see me on a regular basis for the next 2 visits a year, 4 visits a year. You don't want to schedule that. That's fine. I understand that. But here's what I want you to also understand. 2 things. 1, if the pain starts to come back, I do not want you to think for 1 second that our care didn't work. It worked perfectly. It just means that the instability has now gone active, and you need to come back in for an adjustment or two, a treatment or two, and you'll be right back to where you were. Now, doctors, if you tell them that, and you basically tell them, hey, look, you can hit this, and they hit it, your credibility goes up, not down. If you don't tell them about it, so if you don't give them their future prediction of what they can hit, and you don't tell them about it and they hit it, they think your care failed. Now, this inability to communicate will cost you a lot in referrals. It'll cost you a lot in goodwill. It'll cost you a lot of patients who think, oh my gosh, I just went through 3 months, 6 months worth of care, and now this thing is starting to go chronic. This didn't work. Simply because most doctors don't understand ligament injuries enough to understand what to communicate to the patient so that they make better patients, so they get better compliance, they get better results, and they get better referrals. And it's very, very simple. You have the ability to predict. I have the ability to predict if I have a patient who's somewhat unhealthy coming into these injuries that it's going to take longer. I have the ability to predict that it's going to be slower. I have the ability to predict if they're not compliant with their treatment program, that it's going to be more problematic. I have the ability to predict if they're super dehydrated, that it's their risk for long-term chronic pain is higher. I have the ability to predict if they're obese, that same thing. Their long-term risk for chronic pain is much higher. I have the ability to predict a lot of things. And the providers that we train do as well. When you have a spinal ligament injury, you have to find somebody who understands this injury. It is the most common cause of chronic pain and disability in the world today, and it's the most expensive injury in the market today, and there are too few doctors whose primary focus is this condition, whose primary focus is leading their competency in this area to be extremely high. Now, I have a program called the Smart Injury Doctors Program. We're creating some of the most competent doctors in the market today for spinal ligament injuries. And so that's what these programs are about. They're short, sweet, and to the point. What I'd ask you to do is if you have difficulties in the personal injury market right now, you have difficulties in the work comp market, you have difficulties in the injury market, tell me what they are. Tell me what they are, because these are some of the easiest injuries in the market to work with once you're competent with the condition. It really is. These are not hard injuries to work with. It's just that there are so few doctors that even understand how to, at first, just competently diagnose it and really be competent with it. I mean, really certain with it. So that's what we do. These programs are short, sweet, just to bring up a topic, bring it to the point, bring it to a point, and then tell you thank you very much for taking your time out of your day and giving me your attention. I look forward to seeing you on the next program. Have a great day.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.